That was the talkradio.nyc Encore broadcast. We hope you enjoyed it. Now for the live shows. Professional Serving Community, talkradio.nyc.
Hello and welcome back to the Expansion Room. My name is Shervon Laurice. I'm your host, and today's episode is going to be talking about chiropractic care and how it can relate to mental health and mental wellness improvement. All right. And today we have a special guest, my own personal chiropractor, Dr. Terence McAuliffe Jr. And I have had a long history with chiropractic care. 25 or so years ago, I was in a car accident where I had some neck injury. And the first time I walked into a chiropractic's office was for care around pain and pain management just after that accident. And I was actually working with Dr. Terence McAuliffe Sr. at that time. And things got all good and better. And then I moved out of the town that I lived in at the time and moved back 20 years later and came back to find that Dr. McAuliffe Jr. had started to take over the practice. And so I started to go back for my own maintenance because I felt like some of those old creaky pain points were starting to slip back in 20 plus years later. And so now I go a couple of times a month for maintenance, and it feels good for my body to have the right kind of care in this way to keep me balanced. So we'll talk about what that can look like today. So Dr. McAuliffe, can you unmute yourself and share a little bit about yourself? Introduce yourself to the audience, and share with us a little bit of history about your practice and chiropractic care in this country.
Yeah, absolutely. So I'm Dr. Terence. I go by Dr. Terence Jr. usually because I am a fourth generation chiropractor. So my dad, my grandpa, my great grandpa, as well as plenty of aunts, uncles, cousins, and everywhere in between the family are chiropractors. So it's been over 100 years in the family since 1923. So plenty of McAuliffe chiropractic offices over this country at this point. So very cool. So I grew up with it. And with that being said, because my family has been doing this for so long, we have a very historical approach to how chiropractic was designed and how it's developed, while also then updating our techniques to meet the needs of each new generation and each new problem that the world has unraveled for us over the
Yeah,
decades.
right.
So always constantly evolving, but making sure we hold on to the roots of what chiropractic was designed to be and how it was supposed to work with the spine and the nervous system at its core.
Nice. And in those early days, say about 1800s, what
Yeah.
was I guess the care philosophy, or how did it
Yeah, so
rise?
chiropractic started out really, the 1800s, 1900s. I was doing a couple of things of research to help answer this question a little better. I mean, we were still leeching people as a main source of helping with inflammation. So healthcare in general was a little bit the wild, wild west. So the first adjustment happened in 1895, and D.D. Palmer was a magnetic healer. So just like general, what we would probably talk about now, more like Reiki, body work and things like that. And he noticed on I would say patient, but I don't know if they knew what they're that he was going to be
Right.
his first patient at the time. But the guy's name was Harvey Lillard. He had a bump, they said, on the side of his neck, and he hadn't been able to hear for 17 years. So he wasn't deaf his whole life, but he hadn't been able to hear right. And so it was basically out of place. He pressed on it, and the guy said, "Oh, I hear the horses on the cobblestone for the first time in 17 years." So it never
Nice.
started as a pain profession. It started out as a balancing and muscle work and finding the nervous system, and it expanded from there. So as they built their philosophy and treatment protocols, Dee Dee's son BJ, who's really the main propagator of chiropractic to the world. He founded the first school, and he really pushed the science behind what the philosophy started out as. And that's where they came up with the subluxation, which is a term that chiropractic has been founded on, which is a misalignment in the spine that causes nerve pressure. And that's
Okay.
what chiropractors really focus on. And those nerves go so many different places in our body, literally everywhere, and
Everywhere.
connect down and back. So that feedback loop is so important for what we do. And that's the basis of what chiropractic was founded on. And it's just added things over the years, just like other healthcare modalities and professions have. Some specialize down and others expand. And ours has done more of the expanding than the specializing down at this point. But it's an ever changing landscape.
Yeah, pretty much like everything else is, or at
Yep.
least should be.
Yeah, right.
Yeah, wonderful. Thank you for that. I didn't realize that the some of that farther back history. So
Yeah.
thank you. Perfect. And so in the evolution, I remember, I'm old enough to remember when chiropractic care was not covered by insurance and people thought it was weird or woo-woo and some alternative thing that people would do. What was the shift that caused like mainstream healthcare to go, oh, we need to take a better look at this or a second look at this?
Yeah, so two big things. So one thing that BJ did early in the 1900s was he really pushed for chiropractors to be able to use X-ray and use that for research, not only for what was changing over time, but then to have a better diagnosis or prognosis protocol for this is what we're correcting, this is where the problem is, and tie some of those more subjective findings, it hurts here, it hurts when I do this, to more objective things like, and do things like build out the Merrick chart, which is the this nerve goes to this organ, this nerve goes to this muscle. It's called the Merrick chart, those
I
type of
love
things.
that
And
chart
so,
in your office.
yeah.
Yes.
So those pieces of research and information help build the efficacy of chiropractic. And then I'm going to glaze over a dirty part of history. There was a giant lawsuit where the AMA was actively trying to squash chiropractic as a profession
Oof.
in the 60s.
Okay.
So once that was settled and there was no active coordination from mainstream medicine to keep chiropractic down, it was open season for us to become more mainstream.
Okay. So then that was probably maybe
Yeah.
a good
So
thing.
that would be the 60s. So then it took then
Hmm.
into the 70s and then the 80s where it really opened back up because it was like, oh, basically our clients want this, so we should cover it. And obviously insurance was very
Yeah,
different in the 80s and the 90s than it is today. But it was a
absolutely.
part of that expansion of benefits that a lot of different insurance companies experienced. And it was really good for the profession. And then getting the last domino to fall for real acceptance overall was when Medicare started covering chiropractic for at least acute conditions. They don't cover everything because it's Medicare, but that
Yeah,
that's essentially a big federal government red stamp of approval if you're covered by Medicare.
that is true. That is very true,
There's good
especially in
and the
this
bad of that,
country.
right? But it
Mhm.
is a part of the acceptance of it.
Yeah, yeah. Okay. And how does chiropractic, because I've experienced this, but I would love you to share with the audience, how does chiropractic care approach whole person wellness, which is part of the new paradigm in my mind of where we're going in mental health, and I believe where we need to go in physical health as well.
Yeah, absolutely. So with chiropractic, you want to always take a full body approach because the real question isn't for us isn't where it hurts, it's why, right? And
Mm-hmm.
so just because someone's foot hurts doesn't mean that it's something going on in the foot. It obviously could be the nerve in the low back or an entrapment along the way. That's an easy example to kind of picture in our heads. Doesn't mean I'm not going to check the foot and make sure I rule out all those different things that could be causing it. But if
Right.
you take a wider lens of the patient, their problems, and have the training both anatomically, neurologically, physiologically to build those things out and make sure you're getting to, a little bit of a trendy term, the root cause. But, the deeper you go and the more baseline you go, the easier you can find a true and longer solution and not just patchwork, if you will.
Absolutely. And a lot of the work that I do in yoga therapy, they've taught us definitely go to work with the whole person. And we also look at like how people's muscles and muscle trains affect their body. And one of the things I've heard from people sometimes is like a certain set of muscles or pressing on a certain nerve that's causing them pain. And so I imagine that some of the work that you do as well is to also notice how um, muscles, posture, and how they carry themselves also affects their nerve function.
Yeah, of course. So, like with, posture is a word that gets thrown around in chiropractic a lot, but it can mean so many different things. So, you want to find out, for example, if the old knee injury that has been causing him to walk out of balance one side more than the other for 10 plus years is the original cause of the problem, or if it's the car accident that had them leaning like this for the 20 years prior to that, that led to the imbalance in the hips, right? And so
Right.
using x-rays, using some orthopedic and neurological exams, you kind of peel back the layers of the onion to kind of figure out what started first and how you can then build back not only how the spine is communicating, brain downwards, but then how
Hmm.
everything is communicating body upwards as well. Because our
Yeah.
brain needs that stimulation and nutrition through movement. And if you don't, that's where a mental health or anxiety and things like that, when you stop moving as well, then the cycle propagates and gets worse. And so, when chiropractic helps the movement patterns, then it's
Hmm.
helping your feedback loop for all of your other patterns as well.
Absolutely. Fix one thing and it affects everything very much. One of the things I talk about in with clients, especially those who have depression that keeps them less movement oriented, I'll say, or as we say in medical terms, sedentary, is trying to get them to move because it
Absolutely.
helps to move that energy, right? And if they can just go for a walk for 10 minutes around their neighborhood, it shifts everything for people. And I know for me, when I've had physical pain in my body, even though I don't want to move in that moment, I find that movement helps, because it helps to move that energy. And when I come to see you, if I've been stiff, stuck, my favorite times to come see you is after a long road trip because we're just folded up in a car for hours. And then I'm just like, I
Agreed.
just need to get into the office.
Agreed.
And so it feels like the movement that you do through adjustment also gives almost that same relief of getting out and going for a walk.
Well, yeah, and it releases very similar, neurotransmitters, and it leads to a similar dopamine response. Um, and I would never say that the adjustment would replace exercise or movement
Right.
entirely, but they work as simpatico as possible, right? They're the
Exactly.
1-2 punch, if you will. So I 100% agree with that, Shervon.
Excellent. All right. Well, we're going to take a break. And when we come back, we're going to talk a little bit more about the nervous system in chiropractic care and move into the mental health side of this. So come on back.
Are you a conscious co-creator? Are you on a quest to raise your vibration and your consciousness? I'm Sam Leibowitz, your conscious consultant, and on my show, The Conscious Consultant Hour Awakening Humanity, we will touch upon all these topics and more. Listen live at our new time on Thursdays at 12 noon Eastern Time. That's The Conscious Consultant Hour Awakening Humanity, Thursdays 12 noon on talkradio.nyc.
Are you a high-achieving, growth-oriented leader? Are you interested in developing your authentic leadership while creating a healthy, inclusive workplace? Hi, I'm Dr. Mira Brancu, host of The Hard Skills on talkradio.nyc at 5 p.m. Eastern on Tuesdays, where we discuss how leaders develop the hard skills needed to make a greater impact. We interview experts, have live coaching, and tackle these challenges. Listen to The Hard Skills on Tuesday at 5 p.m. Eastern on talkradio.nyc.
You're listening to Talk Radio NYC. Uplift, educate, empower.
Welcome back to the expansion room, where today we are talking about chiropractic care and its effect on mental health. And in this segment, we are going to be talking a little bit more about the sympathetic nervous system and the parasympathetic nervous system, as well as nerve communication throughout our body and how our bodies are really designed to self-regulate. And so my guest today is Dr. Terence McAuliffe Jr. And I have a question for you. Can you talk about or break down in simple terms how spinal adjustments can influence our nervous system and why that matters for mental health?
Yeah, so I think the first thing with just general neurology is everything has to connect back to the brain somehow, some way. So whatever stimulation or activity you're doing is going to affect your brain. That's our supercomputer. So when you're adjusting the spine, so the things you see on YouTube and the clicks, the cracks, the pops, and there's other techniques too, but I know that's very popular right now. You're
Yes.
stimulating the prefrontal cortex, right? And the prefrontal cortex is the part of the frontal lobe that inhibits the sympathetic nervous system. So when you were talking about regulation and self-regulation, our natural state should be a parasympathetic state, which is rest, digest,
Mm-hmm.
heal, right? So that when something that needs sympathetic response, fight or flight, it can go boom and you can respond appropriately. Where
Yep.
we see the big problems is lack of inhibition of that sympathetic nervous system and or
Yes.
being in a chronic state of stress. So that's the number one thing that the chiropractic adjustment does when it comes to your mental health and your stress and things like that is the adjustment calms down that part of the sympathetic nervous system and allows your parasympathetic nervous system. It doesn't, you can't activate it. It just comes back to the forefront.
Right. As it should.
Correct. Yes.
I am so glad you said that, because in several episodes already and in the work that I do with clients, I'm always talking about activating the parasympathetic nervous system. And when I teach a yoga class, I teach a Sunday evening yin yoga class that ends with 25 minutes of yoga nidra.
Mhm.
And basically, it's designed to activate the parasympathetic nervous system. And I've often said to people, we live in our modern times in sympathetic nervous. It's almost like as soon as you walk out the door, it turns on. And hopefully your home environment is calm enough that when you walk back in the door, that turns down and your parasympathetic turns up. So I'm so glad to hear you put it in those terms, that that is what is designed to happen with adjustments. And
Yeah, and
so, yeah, go ahead.
I was with the other thing too is with the when you work with the adjustment, like so some of the things we do in our office that not everyone does, but I'm sure many chiropractors do is, we do the adjustment and then the thing right after we do is the traction table, the IST table. And it's most people don't understand that it does help with the spine and things like that. But quite honestly, if I could get every patient after they got adjusted to just lay down in a dark room for 10, 15 minutes and just chill, that would be almost as valuable as anything that machine does because you just have to let things balance out and we just don't take the time like you were saying sometimes. It's hard. We're busy.
Absolutely.
I get it, but
Absolutely. I agree. That 5 minutes that I take on the table is like I put it almost akin to just taking a moment for meditation after my
yeah.
adjustment. And I never get on my phone. I sometimes look over and people are like on their phones. And it makes me laugh. I'm like, you are missing out. But at least they're on the table.
I hope that what they're dealing with is as important as their health in that moment, and they do something else
Exactly.
to balance that out later. I try not to judge,
Exactly.
but I think the same things too. It's like whatever game you're playing on your phone could have waited 5 minutes. You could have just relaxed, but oh well.
Indeed. It reminds me of, so I've also incorporated at different points in my life acupuncture.
Mhm,
And acupuncture has that same idea. Once you have all the pins and they come and they remove the pins, or even while you've got the pins, they allow for this length of time for you to just lie there. And it's
mhm,
such a game changer, especially I found when I would do it in the middle of the day, like during
mhm.
lunch, it
Yeah.
would reset me. And for the rest of the afternoon, I was good. So that time that you have incorporated in for the traction table is valuable. We
Mhm,
say the same thing in a yoga class, like don't skip out on Shavasana. Shavasana in most yoga classes is the last 5 minutes. When I teach, I try to make it the last 10 minutes so
mhm,
that people's bodies can relax and incorporate the poses and the movements they did, but also to just give them time, right?
mhm.
Instead of rolling up the mat, running out the door, and doing the next thing, But people don't always get the value. You have to almost explain it.
Yeah, and it's hard, right? It's we all know to floss, brush and floss, but not all of us do, right? And I'm sure our dentist would have the same conversation with us, or
That's
whatever it
true.
may be, right? So I wish it
Yeah.
were a unique problem for just me, but it's
Yeah.
reminding ourselves, and then sometimes it takes, oh right, that's what worked for me last time, and it's so it's a constant reminder as a provider to find people where they're at on their journey and continue to move them along rather than be like, oh, they're good, they know what they're doing. You got to stay engaged because it's a part of the process for all of us.
Indeed. Indeed. And the reminders do help because things fall off of our radar.
Mhm.
Something else pops up for importance and we whatever it was. I always had this since my 20s when I started working with people. I realized that we all take in information, and I had this vision of the long table of our minds, and we put something on the table in the front, keep putting things on the table, something is going to fall off in the back. And that's how I imagine it. It's like we bring in all of this stuff. All these things need, our attention. Something is going to fall off. So we just have to pay attention to our own self-care in that way.
Constantly.
Indeed. What role does fascia play in the idea of number one, adjustments, but also just this kind of regulating the parasympathetic nervous system?
Yeah, so for fascia would fall kind of in treating of fascia and things like that would generally kind of fall in like one of the things that chiropractic has scooped up a little bit with more like the physical therapy side, as well as like
Yeah.
some of the body work things that you've worked with. When we're evaluating things from a spine, nervous system, disc spaces versus muscle movement or fascia, different portions, we're looking for like things like how your gait is. So are you balanced? Do you have a head tilt, which would indicate, a brain dominance, a right brain versus a left brain, which then obviously changes your coordination or changes the forward head posture. So we're always going to look at the controlling pattern first with the nerves, and
Mhm.
then obviously rule out anything like a tear, inflammation, bursitis, rotator cuff, and things like that, and then manage appropriately orthopedically and neurologically to kind of meet in the middle. So with fascia specifically, if I were to find an injury or if I were to see an imbalance, the first thing we would do would be work on the spine and that nerve control of it and see how that does in balancing it first. Then at
Okay.
that point, then I would be like, okay, this is what you need to do with acupuncture, yoga, stretching, specific movements. Here's how we can alter your gait pattern, those type of things to then activate and bounce back to connect those two things at both ends of the spectrum.
Okay. Nice. Because I think fascia is one of the things that is, I would say, not talked about enough. But yeah, there is that
Well, in a lot of the fascia,
connection.
the other part with fascia too is that it can be a storage site for toxins and things in our body.
Yeah.
So like particularly with medications and things that have longer half-lives, that's something that as you start to move it or strip it or do these different detoxes and things like that, you'd want to be aware of, and then be aware of what you're feeling through that process. Because you might think you're almost
Mm,
like, oh, I'm not doing anything. Why do I feel this way? But it's kind of like fat tissue and fascia and things like that can store some of those things long term as well.
right. Okay, had forgotten that. And the drinking of water, you're mentioning toxins, right? So if you're moving and things are releasing, drinking water helps to move things along that much faster.
Yeah, absolutely. The
Yeah.
more hydrated and the better your diet is and things like that, the easier your body can process all the things that it needs to, right? And
Mhm.
sometimes we talk about inflammation like it's a dirty word, and chronic inflammation really is.
Yeah.
But if you roll your ankle and it doesn't inflame, I
And
would
then
be very
something's wrong.
concerned
Yes.
because it's a natural response
That's
to
right.
an injury. Where
That's
it
right.
becomes chronic is where it's not an injury anymore. It's now
Yeah.
your life, right? It's
Yep.
not like we were talking about with so many other things. So, you know,
That's right.
if you fall and you're not sore the next day, I would be surprised. That's not necessarily a
Hmm.
good thing. If you go to the gym and work out very hard, I would hope you were sore because you had a good workout.
Right.
It shows that you're alive, right? So it's balancing what is to be expected versus what would be an unexpected result with a lot of these different types of things.
Absolutely. Absolutely. Nice. And when people think about coming to a chiropractor for the first time and they have fear
Mhm.
because they're like, oh, that looks like it's going to hurt. What do you
Sure.
tell them?
Well, I mean, you know me personally, obviously, but
Hmm.
I am I'm here for any question because I not that I've heard it all, but I'm attempting to hear every question at some point in my career
Hmm.
because I would if I can't explain what I do well, or I can't understand their fear and explain why that's not something to worry about, both from a I'm going to do my job so that I take the best results for you, but also, remembering that this is also my license, my livelihood, and support my family. So, you know,
Hmm.
I would never put something that would jeopardize me or my patient, so I take x-rays on every patient when they come in,
Hmm.
and that way I can rule out everything else that could be a problem for me. And or if I see something that isn't a chiropractic concern, I could refer out,
Yeah.
and send them to either their primary first, an orthopedic, or what have you, or just treat that area completely different with the different techniques that I know, or softer techniques or different things. And some of those things are preference, whether it be because of fear or things like that. And other things are because that's the best technique for that person in that moment.
There you go.
So it kind of depends where their fear is coming from. And, sometimes it's not really fear. It's more of like they want to make a joke because it's a more of like a discomfort, getting to know me thing. And other times they really are scared. And so there's a different tone and different conversation. So, you know, I'm open book. So, whatever comes my way, I'm ready to answer for. And sometimes it's funny. And sometimes it's actually like, oh, I heard this or this actually happened. You're like, okay, well, this is why it's not going to happen here in my office.
Right, right. It's funny. Years ago, I had a client who made a really, I felt like it was a crass comment about chiropractic. So she was complaining about something, and I said, "Do you have a chiropractor?" She's like, "That's witch doctory." I was just like, "Never mind." Well, I did not bring it back up.
Maybe not the best referral.
Yeah, no, she wasn't even open to it. I was like, "Okay, never mind."
Yeah, exactly. Well,
All
and the other
right.
part too is like, just because you have a bad mechanic one time or it wasn't the right fit for you doesn't mean you're never going to take your car to a mechanic ever again. So sometimes
Absolutely.
it's just making sure that I understand what the experience they had previously, why it didn't work for them, so that I can help
Absolutely.
meet their expectations both now and moving forward. And, I can't say I
Yes.
do that for everybody, but it's like therapy, right?
It's like therapy. Very much so. I've had many a client who's had a bad experience with a therapist in the past. So on that note, we'll take our next break, and when we come back, we will talk a little bit more about trauma, anxiety, and depression. So come on back.
Misalignment within your sales team or with a client stalls deals and creates unnecessary friction for you and the client, resulting in up to 37% lower win rate. If you're in pre-sales, sales management, or sales enablement, and you'd like to increase revenues, win rate, margins, client satisfaction, and stay competitive, this show is for you. Hi, I'm Art Fromm, host of the Making Seamless Sales Show. Please join me live Thursdays at 7 p.m. Eastern on talkradio.nyc.
Have you ever wondered what truly lies beneath the calm? I'm Jacinta Yang. Join me every Wednesday at 1 p.m. Eastern Time on Talk Radio NYC as we explore healing, self-discovery, and the space where science meets spirits to help you find peace in a busy world. Take a deep breath and tune in to Beneath the Calm, where every conversations guide you back to the calm within.
You're listening to Talk Radio NYC at www.talkradio.nyc. Now broadcasting 24 hours a day.
Welcome back to the expansion room, where today we are talking about chiropractic care and its effect on mental health and mental wellness. And my guest, Dr. Terence McAuliffe Jr., has been giving us a bit of history on chiropractic care and how adjustments help our central nervous system. And in this segment, we're going to talk a little bit more about trauma, anxiety, and depression. And one of my favorite books is The Body Keeps the Score. And in that book, they talked about the research about how our bodies hold on to trauma. And when I read that book years ago and then took the training with a whole room of therapists, I was definitely hooked. It made so much sense to me. And by then I'd already started teaching yoga and then went back for my trauma-informed certification in teaching yoga. And some people even say, and I would probably agree, that some of the traumas that people have lived through and how they show up in their body as they age, you can start to see it. And so, can we talk a little bit about how stress carried physically in the body is affected by chiropractic care? So, releasing the stored tension. What do you see in your patients who may have been struggling, say, with PTSD or
Mm.
anxiety or depression from some trauma that they may have had in their lives?
Yeah, so one of the things that we know about anxiety and depression is so depression is inherently left brained, right? So
Yep.
it is worried about things that have already happened. You're projecting into the future, you sabotage your own like belief systems, if you will. That's kind of like
Yep.
what left brain depression is. Whereas anxiety is more right brain. You're more worried about what's happening today, what's going on in the future. You're uncertain, and then it's that's how that's sabotage. So when we think about that from a chiropractic standpoint, we're looking at how different things like head tilt, different weaknesses with forward head posture, how that informs us about some of the neurological things going on that then their body is displaying, right? So changing that feedback loop into that prefrontal cortex, changing how things are moving to release some of that stress and tension that's going to go to the SEM, go to the traps, and go to some of those things you feel, but then help that feedback loop neurologically as well with the brain.
Nice. Interesting. And so I hadn't given any thought to left brain, right brain in reference to
Mm-hmm.
depression and anxiety in this kind of context. But that does stand to reason because I know when I watch people who are depressed, they often have a posture of like the rounded shoulders, the lowered head, um, and just this kind of, it's almost forlonged look,
Well,
maybe.
yeah, and so I'm sure with everything that you're doing professionally, it's not it's about you want to say it's breaking a pattern, right? But
Right.
it's really about building the new pattern as much as it is about stopping the propagation of the old. And so,
Yeah.
that frontal lobe that does all of our executive function and how we think and stuff like that is stimulated by the chiropractic adjustment. So if that starts to stimulate and this posture gets better, how is that going to feel? But then how much more likely are you going to be able to go do the things that give you a dopamine release, that increase your serotonin levels, that, you know, all those other things. It's the cycle. And so for me, obviously, as a chiropractor, that's where I'm starting from. How can I expand it
Yeah,
to
exactly.
whatever they're trying to get to and wherever they are on their journey?
Yep. That makes sense because that's the same reason why we try to get people moving so that as they get past some of that stuck energy, they feel like they can do more, have more
Mhm.
capacity. So, yeah. And so when you've worked with people, and I don't know if you've worked with people specifically, like we sometimes see people who have experienced trauma, either because they were in the military or they work in law enforcement, or just like lived in a traumatic, neighborhood somewhere.
Mhm.
Um, and that comes out somehow um, in your work with them, and you see that displayed in their bodies. What do you share with them that they can do in between sessions, right? So once they're coming to see you regularly and they get to say that once a week and they then need to be doing something on their own, what do you share with
Yeah.
them?
Yeah, so obviously, as we go from more of a corrective intensive schedule to more wellness maintenance, I'm going to always be trying to give people different exercises and stretches and movements that are going to help them with their day to day. And those might be different for somebody who's sitting at a desk all day versus somebody who's driving all day versus someone who
Mm-hmm.
works at a construction site or what have you, right? And
Okay.
I'm also going to take into account their x-rays and what they can tolerate and where their baseline is right now. But if I were to give any one major piece of advice to pretty much every patient, I tell them to go outside and walk. And
Nice.
whatever your baseline is, right? Whether that baseline right now is just from your front door to the mailbox, if you're doing that constantly every day, once or twice a day, it's going to turn into the next door neighbor, which is going to turn to the end of the block, which is going to turn into, 30 minutes every day. And, at that point, you know, if you decide to be a runner, just go be a runner. If you decide you'd rather go to the gym and do a hit workout, then do that. But then now you have a baseline, and walking is the human baseline. We're designed to walk and move. And if you have
Yeah.
that baseline, you can build anything on top of it. So, keeping people out of pain, helping them balance their nervous system, and then encouraging them to do those things outside of my office to move everything in the right direction is second to none.
Yeah, absolutely. And how much does mindset? We talk a lot about mindset on this show. How much does mindset play a role in your work with people?
Well, you know, for me and the staff in my office, we make it an absolute mandate or way we do business is to be the happy people when you walk in our door. We only have control of our four doors, and we want our space to feel welcoming and happy and things like that, because that's going to make for better care, and you're going to trust, relax, and have a better experience, which is
Mhm.
only going to help your adjustment work better, right? So it's both a
True.
business, right, to strategy to actually be nice to all your clients, but
Yes.
it actually helps with the healing response. So that's one part of the mindset. And
Mhm.
then second, right, is as you continue to decrease pain, right,
Mhm.
increase their ability to think because of some of those prefrontal cortex stimulants from the adjustment, they're going to make better decisions. And so their mindset now can change, right? So then they are going to ask things like, hey, and I don't remember what it's going to be, right? Because it could be like, hey, well, now that I'm doing this, can you help me with my diet? Hey, now that I'm doing this, can you help me with my exercise? I'm feeling a little bit better. Can you show me something? And sometimes it's, hey, I noticed now that I'm walking more, my knee blank. It's like, but that's still a
Yeah,
sign that things are going, because now they're getting to new and different concerns or problems, which means we're changing our baseline and moving things in the right direction. So,
absolutely. Yeah. There was a moment where I think I experienced that with my knee. Like all of a sudden my knee was bothering me.
right. Well, and
But we figured that
it's
out.
correct. Yeah, it's a part of, I wish I could tell my patients they're never going to be in pain again, but that
Right.
would be an unrealistic expectation for a happy life where we're actually doing things and are active, right? And
Yeah.
it's a normal response when we drive too much or we slip and fall or we push it past our limit, but that's that's why we're a self-healing organism as well.
That is true. And, part of it too is the process of aging. And what I always tell people is, every time you wake up, that's just another day longer that you're going to be on the planet. And so it is likely you're going to have some pain. Sometimes you just wake up and you're in pain and you don't know why. Just,
It's
life.
much better than the alternative.
Exactly. I agree. Do you find um, that chiropractic care works well also for people who have ADD or ADHD? Because that was it just popped up because that's a population that I work with a fair amount, and
Yeah,
we
I take
keep
care of a
hearing
lot
more.
of kids that have ADHD,
Okay.
ADD, behavioral disorders, because it brings ease and tension to the nervous system, right? And so
Okay.
when the big one for that is it helps to, like I said, stimulate the frontal cord, which is our executive decision making, right? So kids with
Mm-hmm.
ADHD, ADHD, they don't have the ability as well as others to make the decision of don't do that, do this, right?
Mm-hmm.
And um, if you continue to stimulate the correct part of the brain, not the right part of the brain, then you allow them to make the better decisions and focus, right? And so
Yeah.
between that and generally getting those kids to exercise more, particularly boys,
Yes.
because boys
Yes.
are, I say this with all due kindness to my gender, is that we're like dogs. We're better when we've had a good walk. We're better when we've had good recess. We focus better. we can sit down and do math a lot easier and use our left brain dominant analytical if we've just run around a bunch. And, you know, girls are different because their brains develop, left to right, right to left before they develop front and over. And so that's part of where we see the differences in those kids as they're growing up. But yeah, I mean, I see like a ton of kids in that age group, and the phones and the technology doesn't help us as much on that one because they're inundated. And so it's just more effort on the parents and the community to continue to do the right things, which unfortunately are not always the easy things.
This is true. This is true. All righty. Thank you for that. We're going to take our final break. And when we come back, we're going to kind of tie this all together and talk about some practical ways to incorporate chiropractic into one's life. So come on back.
On Frank About Health, we're not just talking healthcare. We're managing disruption and innovation. Over the last 4 years, I've taken you from epilepsy and COVID to mental health, caregiving, and now the front lines of healthcare transformation. Stay tuned for a healthier future as we bring on the innovators, professionals, storytellers, and advocates who show you how to own your healthcare every Thursday at 5 p.m. Eastern Time on talkradio.nyc.
Are you a purpose-driven individual looking for deeper healing, clarity, and growth? Welcome to the Expansion Room, a transformative space for purpose-driven individuals. I'm Shervon Laurice, host, licensed therapist, and coach. Join me every Wednesday at 5 p.m. Eastern Time on talkradio.nyc.
You're listening to Talk Radio NYC at www.talkradio.nyc. Now broadcasting 24 hours a day.
Welcome back to the Expansion Room. And today we've been talking about chiropractic care and how it improves mental well-being. And so in this final segment, let's tie it all together and talk about, to start, what are some daily practices, Dr. McAuliffe, that people can do to support their nervous system health? And then we'll talk about how to incorporate chiropractic into their lives.
This is going to sound like almost like a bad joke, but it's so important for brain health.
Okay.
Do something that makes you happy every day, right? And the reason why, if you want the neuro behind it, is when you do something that gives you joy, you have a dopamine release, right? Which increases your serotonin uptake. And if you get enough good stimulation, right, you're not going to be depressed. You're not going to be as anxious. And so everyone has different things that make them happy, right? And I know the guy who taught me about this part of chiropractic and neurology, he gets his dopamine response off of teaching a class and by the amount of questions and nods along, stuff like that. Now that would give me terrible, like I don't like public speaking like that, especially memorizing things. So like that would not do it for me, right? But and then the real key on what you can do every day, which I think would help everything you do, everything I do, is like, but it has to be something real, right? This doesn't count as the real dopamine response, right? That it's a quick, trick of the eyes scrolling up and down. That's why phones are that shape. It's not doing the same thing that reading does left to right, right? It doesn't stimulate the brain. And so whether that be a walk, or I have a 2-year-old, so playing with my daughter, or my dog, or whatever, it doesn't really matter to a certain extent what it is, but that's so important for everything you do. And then and go for a walk, right? Especially if it's nice out. It's so good for you.
Yeah, and in the sunlight.
Yes, absolutely.
I discovered last year that we're, it's not that I discovered, I was reminded that walking in the sun was so powerful for setting and resetting our circadian rhythms. And I stopped walking with sunglasses because I
Mm,
wanted that experience of getting
yep.
in, the sun rays that trigger, And so that is one of the things I love is actually getting out and going for a walk in the mornings. I also tell people to dance in their houses. That's my favorite
Absolutely.
thing. I put on
Yeah,
music and there's a dance party that happens in my house several weeks, but I'm by myself and I like it that way.
that's good. Right, yeah, right. And like I said, like you said, everybody's going to have something different. And,
Yeah,
it's, you can't be afraid to sing in your car because someone's going to see you driving down the highway.
exactly.
You got to do it for yourself. And maybe you doing that will trigger the other person like, hey, that person's having a great day. I'm going to
Great
turn
day.
on whatever, right? You never know how far reaching it can be.
Yeah, I usually tell people to make a playlist. You got to have at
Hmm.
least one mood elevating playlist that
Hmm.
when your mood is feeling a little sketchy or you're feeling a little off, that's your go-to playlist. And I have at least two hype playlists
There you go.
for that reason. Wonderful. And so, what's the easiest way for someone to incorporate chiropractic care, right? So, my base is here in Maryland. I come see you, but
Hmm.
this is a broader show. And so, how would they do this in their area?
Yeah, I mean, you know, uh, I always try to help anyone that I know, friends, family members, and or family members of practice members. If they don't live in our area, I'll look for chiropractors for them that I think will do a good job. And
Nice.
and obviously I'm biased. I'm going to look for people who practice more similar to myself.
Yeah, yeah, absolutely. We do the
And
same
that's
thing as therapists.
I would assume that other people might take me off their list if that's not how they practice too. But
Yeah.
I would always be looking for personally when I do for friends and family is look for a doc that says they do X-rays because I think there's a lot of clinical value in knowing what's going on underneath. Not as much from a risk management standpoint because that's not really why we take films, but more of a more complete understanding of the neurology biomechanics going on underneath.
Okay.
Um, Two, I would look for somebody I would make sure their hours work for you, right? I would look at their office hours and see, because if you can't get in, then it's not a good fit, even if they're the best doc around, right? And then
True.
um, yeah, those two things, and then looking for, and even just calling the office and asking, do you work with this condition regularly? Right? Because
Mm,
maybe you're a car accident, we're in a car accident, maybe kids, maybe it's, people who are older, 65 plus, things like that. And maybe that's just not their specialty. So, you know, calling and just asking. The front desk is usually well trained, and if not, you can always ask, just talk to the doc briefly and see if you'd be a good fit. Because I would expect the average doc would rather spend 5 minutes on the phone with a case that isn't good for them than have them come in as a new patient and have to do all that.
yeah. That's a good point. And I've noticed in your office, you work with families. Like sometimes
Yes.
whole families trot in to
Yes.
get their adjustments together. It's almost like the family that gets adjusted together stays together or something.
Right.
But
Yeah. And one of
I imagine some spaces are not able to accommodate that, right?
Correct. Yeah. And so, our hallmark was we call ourselves the family chiropractors. And
Yeah.
so our family taking care of your family, those types of things. So that's like a big core of our group. But a family can be a couple, it can be, whether they're 85 or 25 or, no kids, two kids, now their kids are at college and it's just the parents now. So,
Right.
there's so many different things along phases and things along the way. But yeah, making sure that that's what they do. Or if you have a specific thing, like, oh, I had a spinal surgery here, making sure it's somebody who's competent and comfortable with that. Because, not everybody does everything, right? And not
Right.
everybody wants to focus on everything. And our profession is just as susceptible to the over specialization as anybody else.
Hmm.
I actively try not to do that, but that's not what everybody wants to do.
Yeah, that's fair. I think I would also add, like, if you're looking for a chiropractor in your area, and you've experienced trauma in your life, look for someone who has a trauma-informed philosophy, and ask those specific questions. For some people, they don't like to be touched in certain ways, right? And so having that conversation with your chiropractor and seeing if it's well received, and if it is, then that's the person you move forward with. And if it seems like it's like not, then maybe you keep shopping, right? And
Oh,
so,
absolutely. Yeah.
yeah.
My friend Des had a something like that this week with me. They're like, this patient called in for this, and it was, 13-year-old with some sort of I can't, I don't get the full story because I didn't talk to him, and it was like,
Right.
all these different things, and I was like, okay, well, give, they're on my desk if I want to go in this afternoon to follow up with, but it's like, no, well, I'll call them and I'll review it with them to make sure this is gonna be a good space for them, and
Yeah.
with that demo, I'm talking both to the mother and the daughter, right? So I've got to thread two
Right.
needles, but being open to that conversation, like you said, and receptive to it, if in a attempting to find a common ground and a way through to get the treatment and things that you need. But there's so many techniques with chiropractic, it shouldn't be that difficult.
Right.
Well, I say
Hopefully.
that, but I'm flexible and I want to be flexible to help people, so maybe that's
And that's the attitude we're looking for. I think that another thing that's helpful in looking for a chiropractor is, do they collaborate with other mental health providers? I know that I have referred people to you, and you have referred people to me, and I think that it makes sense in this mental health landscape, as we're shifting this paradigm, to look for a chiropractor or any other kind of care outside of the traditional medical system who is willing to collaborate, right? Collaborate with your doctors, collaborate with your mental health providers. And so I think that's key as well. And you're very client centered. And that's a hope for me, to anyone who's looking for a chiropractor anywhere else. Look for someone who's client centered, right? They're willing to invite you in to the process of your own care. So it's not just come in, get on the table, get adjusted, get out. Right.
right. Yeah, and it's not always easy to build the rapport with somebody in, the first visit or the second visit, but
Right.
if you're constantly building on that moving forward, they're going to be more open with you with how you're going to take care of them chiropractically, but then also how you can take care of the other things with that, whether it be good advice or a good referral or
Mm-hmm.
here's what we can do new or whatever along the way. You can, that rapport and being able to listen and not listen to speak necessarily, but listen to find solutions together is so important in our profession, probably even bigger with what you guys do.
Yes, 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 yes. All right. Well, thank you. So, are there any other tidbits or pieces that we didn't talk about that you would like to add in here at the end?
Um, Everyone go see a chiropractor, come to my office. No, I'm just kidding.
I
The
highly
no, but
recommend Dr. McAuliffe.
no, I would say that, if I were to give any true and real feedback is, just like with your mental health, with your exercise, with your dentistry, but also with your chiropractic, right? The earlier you start things before things are an emergency or before things become a problem, the easier things are to manage. So when you feel something coming on, don't wait, right? And
Yes.
be proactive. And sometimes proactive means, seeing somebody, for your spine or seeing someone for mental health less frequently for a longer time so you don't get
Hmm.
to the point where you have to come in and see me every day for 2 weeks to get back to being able to walk again, right? But the same
Right.
thing goes true for your mental health. Same thing goes true for your exercise, your diet, and it's another pillar of your health. And so, us chiropractors like seeing wellness patients almost as much as we like seeing, really helping with those miracle cases.
Yeah.
And keeping people well for years is, trust me, just as much fun as getting somebody out of pain for the first time in years.
Beautiful. What is the longest running client that you've had so far in years?
So I've been in the office for 12 years in April, so 11 and a half or so. The longest continuous patient has been coming in to the office since 1990.
Nice. Okay. That's perfect. I love it. All right. Well, thank you so much for making the time
Thank you for having me.
and coming and sharing all of the valuable information. It was such a pleasure. Thank you. And to my audience, if you've heard anything that resonated with you and you think that this could be a benefit to someone in your life, please share this video with them, as well as like and subscribe on any platform that you're hearing or seeing this. And join us next week here at the Expansion Room. And until then, take good care.
You're listening to Talk Radio NYC. Uplift, educate, empower.
On Frank About Health, we're not just talking healthcare. We're managing disruption and innovation. Over the last 4 years, I've taken you from epilepsy and COVID to mental health, caregiving, and now the front lines of healthcare transformation. Stay tuned for a healthier future as we bring on the innovators, professionals, storytellers, and advocates who show you how to own your healthcare every Thursday at 5 p.m. Eastern Time on talkradio.nyc.
Hi, I'm Linda Marsanico. The A Train to Sedona is a memoir about my journey to love and compassion. It's also the name of my new broadcast on Wednesdays at 12 noon. When we are spiritual, we embrace possibilities and ideas, which strengthen our mind, body, spirit, health, and wisdom. On the A Train to Sedona broadcast, I plan to interview guests who embrace these expansive practices. Join us on Wednesdays at 12 noon on Talk Radio New York City.
Hey everybody, it's Tommy D, the nonprofit sector connector, coming at you from my attic. Each week here on talkradio.nyc, I host the program Philanthropy in Focus. Nonprofits impact us each and every day, and it's my focus to help them amplify their message and tell their story. Listen each week at 10 a.m. Eastern Standard Time until 11 a.m. Eastern Standard Time, right here on talkradio.nyc.
Are you a conscious co-creator? Are you on a quest to raise your vibration and your consciousness? I'm Sam Leibowitz, your conscious consultant, and on my show, The Conscious Consultant Hour, Awakening Humanity, we will touch upon all these topics and more. Listen live at our new time on Thursdays at 12 noon Eastern Time. That's The Conscious Consultant Hour, Awakening Humanity, Thursdays 12 noon on talkradio.nyc.
Are you a high-achieving, growth-oriented leader? Are you interested in developing your authentic leadership while creating a healthy, inclusive workplace? Hi, I'm Dr. Mira Brancu, host of The Hard Skills on talkradio.nyc at 5 p.m. Eastern on Tuesdays, where we discuss how leaders develop the hard skills needed to make a greater impact. We interview experts, have live coaching, and tackle these challenges. Listen to The Hard Skills on Tuesday at 5 p.m. Eastern on talkradio.nyc.
You're listening to Talk Radio NYC. Uplift, educate, empower.